Adrenal fatigue is a diagnosis that most mainstream physicians say does not exist. We are not taught in Western medicine that there is such a condition as adrenal fatigue. Naturopathic physicians use the term adrenal fatigue, and when they do so, they refer to a condition whereby the normal cyclic diurnal rhythm, we call it, of cortisol is not occurring. So cortisol is a hormone that the adrenal glands make. And the adrenal glands are organs that sit on top of the kidneys and are the size of a walnut. If I cut your adrenal glands out, you die in 2 weeks. Very important organs. And normal adrenal function occurs with cortisol levels shooting up in the morning and basically saying, rise and shine, morning is here. And it gives us energy in the morning, what we want to get out of bed. And it comes down a bit throughout the day, but it stays up throughout the day. It doesn't plummet, hopefully. And then at nighttime it comes down. It doesn't disappear, but it drops. When that normal pathway that we all learn in mainstream medicine is not occurring because the adrenals are fatigued, people don't feel good. So they complain of, I just can't get myself out of bed in the morning. Or, I can't sleep at night. And mainstream medicine says there's no reason to be checking that. There's a condition called Cushing's disease where adrenals make too much cortisol. There's a condition called Addison's where they don't make any, and there's nothing in between. Symptoms of adrenal fatigue include fatigue, morning fatigue. Maybe they say, I'm doing okay, but then at 3 in the afternoon I just die. Or I get a little boost of energy in the evening and then crash. Another symptom is a woman will say, well, when I start my menses, I start and have a minimal menses for a couple of days. It stops bleeding, and then the period starts. So there's kind of a 2-step onset of the menses. The high cortisol at night is oftentimes just a reflection of the adrenals just kind of being out of whack. The timing is just not right. And so in mainstream medicine, a lot of patients come and say, I just have a sleeping problem and I'm on sleeping pills. But they're not addressing healing the adrenals. They're just knocking the patient out. So a myriad of symptoms. Also asthma and respiratory symptoms because the adrenal glands make cortisol, which is our own internal natural prednisone. So if they're not working very well, they may not be able to make the cortisol. And so what do? We get asthma and we treat it in mainstream medicine with prednisone. So if we could just get the adrenals to work, oftentimes these respiratory symptoms go away. Here at Nova Medical Group, we do diagnose and treat adrenal fatigue, and we do it based on saliva cortisols. I have learned by working with the naturopaths to prescribe supplements that are high in B5 vitamins, but there are other approaches, and if the prescription of B5 vitamins is inadequate and we're not getting adequate relief of symptoms, or the labs are not returning to normal, I will have the naturopathic physician get involved. They also use things called adaptogens. Examples of this are herbs such as ashwagandha or solid licorice extract, and there are many other things that are used by those knowledgeable in the naturopathic fields. I think the first step in addressing adrenal fatigue is the patient understanding the physical effect that perhaps stress or another event had on their body. So they then take more seriously their role in how they respond to stressful events. Unfortunately, we can't prevent stress, so the only thing we can control is how we respond to stressful events. If we can do things either with yoga, biofeedback, whatever mind-body medicine techniques we can employ to not have negative events, let's say, affect us this way, it is very helpful to do so. Generally, we are able to turn this condition around with 9 to 12 months of treatment. And I like to see it done by the naturopath rather than myself.